Yo, what is high blood pressure?
When we talk about chronic high blood pressure, or hypertension if you want to be fancy, we're referring to a certain pressure inside your body, more specifically, the blood pressure inside your arteries. As you're aware, your body is full of vessels, veins, capillaries, arteries. Now, imagine for a second that your body was a huge city, and inside it, there's this massive underground plumbing system, your blood vessels. Arteries, veins, capillaries, they are the highways and alleyways for life itself. And running through all of them, blood. Now let's focus on the arteries for a second. These are the VIP lanes inside your body, supplying your tissues and cells with oxygen-enriched blood, from the hairs on your head to the tips of your toes. Just like in a pipeline, you need pressure for the flow to actually happen. That pressure comes from your heart, a magnificent muscular pump. With each pulsation, new pressure is generated to pump blood in your arteries around the body. If there were no pressure inside your arteries, your blood wouldn't be able to get to where it needs to get. No pressure, no delivery, no life. But, and this is where things can go sideways, too much pressure and the pipes can start to break down. That's high blood pressure. Your arteries are like mini muscular tubes. They are built to withstand some pressure, but there's a limit to the amount of pressure they can handle. High blood pressure can damage your arteries, and this can occur regardless of whether you have symptoms or not. But I feel fine. That's exactly why it's dangerous. It's sometimes called the silent because in many cases there may be no obvious symptoms. Many people don't even know it's happening to them. Some reported symptoms are fatigue and throbbing headaches behind the eyes, but most people just shrug it off. Probably didn't sleep enough, too much caffeine, maybe I'm just dehydrated. And this is why it's crucial to regularly check your blood pressure. How do we measure blood pressure? Well, we usually measure blood pressure in millimeters of mercury. This unit is used to indicate the pressure of blood against the artery walls. A typical blood pressure reading is expressed as two numbers. For example, 120/80. The top number is called the systolic pressure, which is essentially the pressure in your arteries when the heart beats. The bottom number is called the diastolic pressure, and this is the pressure in your arteries in between beats when the heart relaxes. If you have high blood pressure, the force of the blood pushing against the artery walls is consistently too high. In other words, the pressure inside your arteries is higher than normal. What happens when your blood pressure is chronically high? Well, consistently high blood pressure can damage your body over time. Your heart has to work a lot harder, and your arteries can become more rigid and inelastic. This can cause all sorts of problems. Your blood pressure kind of determines how much blood goes to the different places in your body. It can also affect how much stress many of your organs will face. For example, the heart is a muscle, and if it has to pump against the high blood pressure and work too hard for too long, it'll grow, and that can cause it to get thick. Just like your biceps if you do bicep curls every day at the gym. But wait, isn't a big heart good? Sure, if we're talking about kindness, but physically, a thickened heart means it's struggling to push against constant resistance. It gets harder, less efficient, more dangerous. The heart muscle needs just the right amount of blood pressure, not too much and not too little. High uncontrolled blood pressure for prolonged periods of time can impact other organs too, and may increase the risk of having a stroke, having kidney disease, or eye disease, for example. The key takeaway here really is, high blood pressure doesn't send you a calendar invite. It doesn't tap politely or clear its throat. It waits quietly, and then one day, it makes itself known, suddenly, aggressively, and often without warning. So maybe this is your invitation to listen. Check in, pay attention, respect the force that moves through your arteries every second. So get your blood pressure checked regularly. Don't guess, measure. And whilst you're at it, why not walk at least 30 minutes a day? Your body will thank you for it.